A recent U.S. Surgeon General advisory declares loneliness a public health epidemic, outlining the effects of and risks of isolation. As WTIU's Benta Boutier reports, young people have been especially affected by rising levels of isolation, but older adults are vulnerable too.
The Surgeon General's report this month says social connection has declined for decades, but the sharpest drops happened in the last 3 years. Community resources for connection, like the Area 10 Agency on Aging and Enright Community Center, had to move classes online or alter them for safety during the pandemic. The centers have reopened and more people are coming out, but the rates of depression and loneliness haven't returned to pre-pandemic levels.
People tend to retreat to their safe spaces, to their homes, and when you're retired or you're not working or you don't have this commitment, to a certain organization or whatever you might be doing outside the home, you tend to find reasons to stay home.
A 2020 survey found 43% of adults older than 60 reported feeling lonely. But not Jim Dunbraber, who's in his 70s and lives alone.
I wouldn't classify myself as lonely. To be honest, I find myself good company. And I hope that doesn't sound pretentious or anything.
He describes himself on the shy side. He says exercise, hobbies, and intentional connection with others are all concerted efforts that keep him grounded.
Or squares, or whatever. You can make triangles if you want.
He goes to exercise classes offered at Enright East.
I realize I'm not going to have somebody knock at my door to introduce themselves, so I joined that balance exercise class, and I've also joined a nutrition class.
He sends a daily email that ranges from a joke, quote, or nature photograph, depending on the day of the week, to his family and friends.
An animal on Wednesdays, so I sent that one Wednesday. Let me see if I can find a couple different ones that I sent.
And he goes on walks at the YMCA track to keep his legs strong, since he had polio as a kid.
All right, here it is, a lovely day at the YMCA off Winslow Road. And this is where I come every day to walk at least 2 laps around here, listen to headphones, and enjoy the spring coming on.
The Surgeon General's report says loneliness can have health implications just as serious as obesity or heavy smoking, and is correlated with premature death. Census data ranks Indiana in the top 10 for people divorced and who live alone. These factors contribute, but the Surgeon General report says loneliness is a subjective internal state, and they aren't the only causes. IU psychologist Ann Crendel studied isolation among older adults in Monroe County during the pandemic.
In the first 3 months of the pandemic, loneliness peaked, but it got even worse the 3 months after that. It's sort of that phase where I think people started to recognize that the pandemic wasn't going away immediately. So loneliness peaked even higher.
The Surgeon General report says fewer people report being involved in their community in the last 30 years. And since the pandemic, people reported having fewer close friends.
My suspicion is that there's some cascading effects from the pandemic that we haven't fully captured.
The Public Health Epidemic Report laid out some recommendations for policymakers, like funding more research, community organizations, and transportation improvements. Dunbraber says people can start with regular efforts in their own lives.
I would advise being active, get out of your house, your abode, and when you are exercising, don't forget to give them a nod or a wave and let them know that they're not alone.
The Surgeon General report says younger people, older adults, and people with poor physical and mental health who have a disability or financial insecurity are at most risk of loneliness. For Indiana News Desk, I'm Benta Boutier.
The Public Health Epidemic Report laid out some recommendations for policymakers, like funding more research, community organizations, and transportation improvements to mitigate loneliness in elderly people.